Yes. So what is it that you want to share with Diversity Magazine audience today?
Well, two big things. The first one is about dental care, and the second thing is about the people. Now, we know that good dental health and oral health is essential. Now, whatever comes into our body needs to go through our mouth. So the health of our gums, our teeth, our mouth, that has an impact on the risk of diabetes, how easy it is to masticate and to digest. So it has an impact on also on cardiovascular diseases. It can, if it's bad oral health, infections in our mouth that can lead to generalized infections in the brain and elsewhere. So we know that, but the problem is that many people listening to us now don't have a private insurance to pay for dental care. So and they have limited resources. Now their income is limited. You need to pay for rent, for food, for school, for many other things. So if we don't have private dental insurance, we typically resist going to see a dentist or a denturist, although we know it's important to go, because if we don't go, then we know it will lead to more expensive and more painful care after. And too many, unfortunately, end up in the emergency department with surgery, emergency surgeries, and that's not good. Now, the good news is that as we speak, there are hundreds of thousands of seniors that have registered to the new Canadian Dental Care Plan since December. That's because we have started with seniors to introduce that new dental care program from the federal government. So it's in Edmonton, it must be close to 50 or 60,000 seniors that have registered successfully to that new Canadian Dental Care Plan. And as we unroll the program in the next few months, it will be all seniors aged 65 and older. In June, it will be all children below the age of 18 and people with disabilities. And later on in 2025, it will be any other adult in Edmonton and in the area that doesn't have a private dental plan from an employer and has a family income less than $90,000. That's very good because about 9 million Canadians in total, and again, probably several tens of thousands of them in Edmonton, will have access to dental care. Now, what is the dental care that is going to be provided? Well, it will be what we call preventive dental care, like a cleaning, an examination, an x-ray, a scaling, fluor treatment for children, putting sealants on top of their teeth to protect them against cavities. It will be things like treatment. It could be a filling. It could be a root canal. It could be a crown. It can also be, for the older Canadians in particular, replacing a denture. People wearing a denture after many, many years need to have that denture being replaced. But those listening to us know that it can be quite expensive to replace a denture. So that's also going to be covered for middle class and lower income Canadians. Again, it's an invitation to all of us listening that will have received a letter from Service Canada to register and then to be able to access dental care later in the year.
So is this optional? Is this by default like the healthcare benefits where when you go to the dentist it's just automatic, or how would this work?
No, it is not automatic. And that's why it's so important to speak about this today. It's not automatic. You need to register. For seniors age 70 and older that are potentially eligible because they have a family income less than $90,000, many of them will have received a letter as we speak from Service Canada. So they can use that letter. There is a phone number on the letter. There is an identification code. So they phone in. It's quite straightforward. There are just a few simple answers to simple questions to answer. And then most of them become eligible. When they become eligible, they will receive a welcome package from a company called Sun Life, which is a company that pays a dentist, but it's all managed by the federal government. So they'll receive a letter and a welcome package that will tell them when they can start receiving dental care and what type of care they can receive. As we said earlier, it will be exams, x-rays, cleaning, dentures, and other essential services and things that they need to be in good oral health. Now, later on, in May and in June, the seniors aged 65 and to 69 and all children below the age of 18, they will need to apply on a portal, a portal that will be a Service Canada portal. So that's why we should perhaps speak later in closer to May and June to explain where people listening to us will need to go to register. Because if they don't register, they won't receive their dental card. The dental card will look like a health card. It will give a number that a card that they can bring to the dentist, the hygienist, or the denturist, and get access to that dental care program by the federal government. So it's not automatic. People need to register.
Thank you. And you say you have two announcements, Minister Duclos.
I'm sorry?
You said you have two important things to share. So the dental care is very, very important one, and I think our audiences across Alberta and Canada, we appreciate that. You said you have another announcement, another important thing to share?
Oh, that's a great question. So on dental, very important, and very important to know that this should have been done many, many years ago. When we introduced healthcare in the 1960s in Canada, it was introduced to give every Canadian essential healthcare that they need. Unlike in other countries where you need to pay for healthcare, in Canada, it's not your pocket that says whether you have healthcare or don't have healthcare. But 60 years ago, dental care was excluded. So since then, when you go and see a dentist, a hygienist, or a denturist, if you don't have a dental program from your employer, you need to pay. And we know that dental care can be quite expensive. We know it's necessary, but it can be quite expensive. So the other thing that we are doing is to invest more in the healthcare system. Because as we invest in dental care, we prevent people from having to go again to the emergency department, for children to be undergoing general anesthesia with emergency surgery that are quite dramatic and traumatic. So we protect the healthcare system by investing in dental care. We know in Alberta, in Edmonton, it's difficult. If you're sick, it's not always straightforward to get health care because the nurses and the physicians are already overburdened. So by reducing the problems with dental care, we reduce the pressure on healthcare, and so it supports our investments, our other investments in patients and in healthcare workers.
Thank you. Anything else, Minister Duclos?
No, just to say that we're very grateful for Diversity Magazine to be interested in that. We believe that a large number of people reading your scripts, reading your documentation, listening to you, benefiting from the great engagement that you have in the community, connecting to Canadians in Edmonton in particular. Many of the people listening to us sometimes struggle to find information on how to look after their family. So we're very grateful to you, leaders of Diversity Magazine, to do all of that work.
Yes, so please just send us a link. Your assistant, I think we are going to follow that with an email. I'm sure there's a link where people can click and get to this Service Canada website and do all the stuff.
And exactly. Sorry, thank you. I was forgetting. So the link is canada.ca/dental. So again, canada.ca/dental. They'll find everyone going there. They'll find lots of information. And if they need more, there is a phone number, a Service Canada phone number that they can use to ask direct questions.
Okay, yes, we'll add the website on the video. Thank you very much for your time. I know you have a busy day, so let you go, and we'll be sure to see you again soon. And whenever you're in Edmonton, let's connect. Take care.
Yes, I look forward to doing that. Thank you.
Take care. See ya.
Okay, bye.
Bye.